Hello, everyone. I am Dr. Sani Datta Gupta, Director of Publishing at Scientific Scholar, and I am pleasured to have with me Dr. Karoon Agrawal. With him, we recently launched the book of the nursing guide of Cleft Lip and Palate. But most interestingly, with him, we have a set of young authors, Dr. Gargi Singhal, Dr. Surbhi Srivastav, Dr. Chirag Sharma, and Ms. Mansha Arora. It's a young blood contributing towards the dissemination of quality clinical information in this particular field. And today I am here to take Dr. Karoon's blessing and ask the young authors that how they felt about producing and compiling this book. But before that, Karoon sir, what was your real motivation of bringing such a young lot in producing this book?
In fact, if we see the clinical work, we work as a senior, but in fact, the ground reality is the junior colleagues, they work much more than what the senior person works. Rather, the senior works only because the juniors are sincere enough and they are dedicated to the care of the patients and the documents. And here, this is an example of creation of team of people who are not experienced in writing, but with little guidance and with little support, how one can create. The reality is my name is there on top because I'm known as author. But all the groundwork, the documentation, the compiling, designing, they're all done by Gargi, Surbhi, Chirag, and Mansha. And if you see the QR codes there, they're all uh, done by Mansha because she knew the importance of video there when somebody reads it. We have been talking about the audio visual, and there it is already incorporated in this to some extent. And it takes you to the YouTube channel, and then it takes then gives the information about this manual as well as the importance of care of children with. So that's the reason why we are here together. And they are budding clinicians. And I'm sure with this experience, they will be able to write much more than what they can think of. Shoot with this experience. Thank you.
So that is a great vision that we just listened from Dr. Karoon. So I would first come to Dr. Gargi. From a practicing clinician, now a author of a clinical book. What was your experience?
A great experience. First, I would like to thank Dr. Karoon Agrawal sir for such a big opportunity, scientific scholar for this publishing our book. And it is a very important book, I think, for nursing manual. It is a guide for all type of care. It includes the comprehensive care. So I think it is a very useful book for all the nurses and even for doctors also.
That's really great. I will come to Dr. Surbhi. As you ventured into this experience of writing a clinical book, a nursing guide, what was really going through your mind while coming on board on this project?
I think it is a very new experience for me. We didn't know as we were, very new to writing things. I think it's all guidance of Dr. Karun that we have, pulled off so much. You guys are saying it is a good book. I hope we have made this book so that friendly, very friendly, so that it is helping the nurse. Um,
That's really great. I would come to Dr. Chirag. Dr. Chirag, now this book, as we are saying, it's a nursing guide, but it is really helpful for the practicing clinician as well. As being an author of this book, what was your motivation and how you see the book contributing towards the clinical practice?
As an author artist, I'm millimeter man. Hello. So as an author artist, I'm a millimeter man. So I thank Dr. Karun for having the confidence and guidance for this book as an author. And I say thank you for that confidence. But as a clinician and for nursing guide, it is important for as an entrepreneur to have a pre-surgical treatment orthopedic that a small child having is from birth to 6 months. I, I do the condition very morning. So it is so I wrote the health guidelines for nurses to um, help them to how to help those child with with that applying uh, having that appliance in the mouth. It will use
Certainly. So now I would come to Mansha. As Sir just said, you all developed the QR codes. It's the age of technology, and this book is definitely going to create its own mark. What was your experience for developing this book?
Great experience from starting onwards only. But I would like to thank Karan sir and the unpublished scientific scholar for publishing this. Thank you.
Uh, so that's the young blood that we work with. We work with journals, we work with books, we work with senior veteran clinicians, editors, and authors. But at the same time, we really believe in motivating and bringing to the world this young generation of clinicians, technicians, and scientists and authors to disseminate quality clinical information and improve healthcare. Thank you. Thanks, everyone. Thanks. Thank you.